Good morning, everyone. My name is Michael Bruin, and I am the Director of Public Policy for the Alzheimer's Association Wisconsin chapter. I want to thank everyone for joining us today for this special town hall with Congressman Glenn Grothman. During these times, it's important that our constituents at the Alzheimer's Association hear from their elected officials on issues that are important to them. This is going to be an interactive event today, and we'll do a question and answer session later in the town hall. Participants can put their questions into the chat box, and we'll have some questions that advocates have submitted in advance on video. Without further ado, I'd like to introduce the Executive Director of the Alzheimer's Association Wisconsin chapter, Mr. Dave Graham.
Hello, I'm Dave Grahams, Executive Director of the Alzheimer's Association Wisconsin chapter. It's my pleasure to welcome you into this town hall with Congressman Glenn Grothman. Alzheimer's is the sixth leading cause of death in this country, but yet the only one in the top 10 for which today there's no way to treat, prevent, or even slow the progression of the disease. The numbers are staggering. 1 in 3 seniors dies with Alzheimer's or some other form of dementia. Here in Wisconsin, there are more than 120,000 people living with the disease today, and another 200,000 providing care for a loved one living with the disease. On a nationwide basis, more than 5 million people living with Alzheimer's or some other form of dementia, and another 16 million providing care for a loved one. The cost to this country in 2020 will be more than $305 billion. In addition, that's expected to nearly triple by 2050. $1.1 trillion is what Alzheimer's will cost our nation. Clearly, we need to get this under control, and we need to find effective treatments and prevention. I'd like to thank Congressman Grothman for his support of the Younger Onset Alzheimer's Act of 2019, and also for his participation in Walk to End Alzheimer's events across his district. Thanks so much for your support. Finally, I'd like to thank you and everyone who's participating in advance for what it will take for us to move this mission forward and truly put an end to this disease once and for all. Thank you again. We look forward to a great conversation here today.
Thank you, Dave, for sharing that important information about Alzheimer's disease. I think it's also important to note that 1 in 3 seniors today dies with Alzheimer's or another form of dementia. It's now my pleasure to introduce Connie Timmig, the Alzheimer's Association's volunteer ambassador for Congressman Grothman. She'll be providing the introduction and bio for Congressman Grothman. Connie, thank you for being here today.
Good morning. My name is Connie Timmig, and I lead the Dementia Center of Excellence at Felician Village in Manitowoc. I'm also an Alzheimer's Association ambassador for Congressman Glenn Grothman. Along with my team of passionate volunteers, we advocate on behalf of individuals with Alzheimer's and related dementias and their caregivers, including my grandparents. Today, I have the distinct pleasure of introducing to you Congressman Glenn Grothman. Congressman Grothman was just re-elected to serve his 4th term in Congress. Congratulations, Congressman. He represents Wisconsin's 6th congressional district and serves on 2 committees in the House of Representatives, the House Education and Labor Committee and the Committee on Oversight and Reform, where he serves as ranking member of the Subcommittee on National Security. During his time in Congress, Grothman has also been recognized for his work to protect Medicare and Social Security by receiving the Guardian of Senior Rights Award. Before serving in Congress, Grothman also served as the Assistant Majority Leader in the Wisconsin State Senate. Prior to his election to the State Senate, Grothman served as a representative to the Wisconsin State Assembly for 10 years. He was also a practicing attorney in the areas of estate planning and probate and worked as a tax preparer. Grothman earned a Bachelor of Business Administration degree in accounting and a Juris Doctor from the Wisconsin University of Madison. He graduated from Homestead High School near his hometown of Thiensville, Wisconsin, and he currently lives near my parents in Sheboygan County in the town of Greenbush. Congressman Grothman was a co-sponsor of the Younger Onset Alzheimer's Disease Act and the Raise Family Caregiver Act. In 2019, Congressman Grothman personally attended 3 Walk to End Alzheimer's in the 6th Congressional District. Thank you, Congressman Grothman, for joining us today.
Okay, thank you much. We are wrapping up right now. Our last session, we'll be back on Monday in a lame duck session. As you mentioned, we did have some success there. The bill HR 1903, the Younger Onset Alzheimer's Act did pass. It didn't pass the freestanding bill. We wound up adding it to another piece of legislation, but I'm glad that that's there now. We are working on the Change Act, which I'm also co-sponsoring. It'll direct the Centers for Medicare and Medicaid Services to require the use of cognitive impairment detection tools recognized by the National Institute of Health and National Institute of Aging for preliminary preventative examinations. Maybe we'll still be able to get that in one of the packages yet to go. So you understand, under normal circumstances, the federal budget year ends on September 30th, but frequently we don't pass the spending and the final bills related to that year until December. So we still have a chance of getting that in there. I think the coronavirus situation will also result in at least one more large significant package bill that'll pass this year. I think one thing that the coronavirus has done is it shines a light on CDC, shines a light on NIH. And I think some of us, myself included, sometimes thinks that these agencies could be moving a little bit faster. And the fact that they are moving faster on some things related to the coronavirus, I think we've got to demand the same sort of action on Alzheimer's. There is a drug out there that may or may not be helpful to Alzheimer's patients. Right now, it looks like they're going to push that off until March. But I think, and quite frankly, I think they're moving a little bit slow on this COVID stuff too. But I think now that we're shining a light on these agencies, maybe that drug can be pushed up for use a little bit earlier. And when I get back to Washington on Monday, I certainly intend to try to do something along those lines. I continue to be a member of the Alzheimer's Disease Task Force, and I'm sure we're looking for a robust agenda in the next 2 years. I think you mentioned you felt Alzheimer's was the 6th largest cause of death. I was under the impression it was the 5th, but in any event, it's a horrible thing. And among other things, it's horrible because it affects so many other family members. It's very time consuming, and I really can't think of anything in which you're getting more bang for your buck, hopefully, than more research along the line of Alzheimer's. So we'll have to see what we'll do. But like I said, I think shining the light on what's going on in these agencies, and sometimes, quite frankly, how slow these agencies move, will be good, because maybe we can benefit by it as well. I would just tell you on a personal level, not Alzheimer's, I've been pushing a drug called phenofibrate on the COVID thing that they're having success on research in Israel. To me, NIH and CDC is not moving near fast enough, which is disappointing, but at least it shows how slow moving they can be. And as far as the whole public health establishment, I don't think they've done a good enough job of pushing vitamin D, which all sorts of studies show is effective. So kind of lowers my opinion of these organizations, and maybe we can leverage some of the things they aren't doing, not only with regard to the COVID, but with regard to Alzheimer's.
Thank you, Congressman Grothman. For those of you on the screen today, I've known the congressman since he was in the state assembly, and I worked for a state representative named Scott Gunderson. So the congressman and I go way back, many years. For everyone else joining us today this morning, just a quick reminder that you can submit a question on Alzheimer's and dementia for Congressman Grothman utilizing the chat function at the bottom of your screen. As many of you know, November is Family Caregiver Month. Our first question comes from a family caregiver in the 6th Congressional District, Brian Wickman. Brian is one of over 195,000 family caregivers in the state who are providing care for a loved one with Alzheimer's or a related dementia. Brian?
Good morning, Congressman Grothman. My name is Brian Wickman from Port Washington. First, I'd like to thank you for co-sponsoring the Younger Onset Alzheimer's Disease Act. With your support, the provisions in this important legislation were incorporated into the reauthorization of the Older Americans Act earlier this year. Thank you. I'd like to talk a little bit about my wife, Ruth. In her early 50s, she was recently diagnosed with posterior cortical atrophy. This is a form of dementia which is usually considered a rare form of early onset Alzheimer's, and it starts with deteriorated vision and then progresses to full dementia. When we were working together to apply for her Social Security disability insurance, the forms that are written as they are now currently address different physical disabilities. It's extremely challenging for families to answer from a cognitive disability standpoint. Is there anything that Congress can do to address this discrepancy and ease the burden placed on families that are caring for loved ones with Alzheimer or dementia? Thank you.
I know that whole disability thing is more geared towards physical disabilities. I do know the Social Security Administration added early onset Alzheimer's to their list of compassionate allowances for SSDI, which can expedite the process. But I think we can weigh in with further. Like I said, I'll be back in Washington on Monday, and we can see what more we can do there, because I do know that whole area of law is aimed more at physical type things, not mental things. So thanks for bringing it up.
Thank you, Congressman Grothman. Our next question comes from Dana, and it's about the politics of Alzheimer's disease and how Congress has worked to address this public health crisis. At the Alzheimer's Association, we like to point out that red and blue make purple, and it's really exemplified that when Republicans and Democrats come together, we can truly accomplish great things. Dana, your question?
Good morning, Congressman Grothman. My name is Dana Elmsen. I'm from Sheboygan Senior Community. Thank you so much for your support in the fight against Alzheimer's disease. At a time when we cannot ignore the extreme partisanship that's occurring in Washington, D.C., Alzheimer's has been an extremely bipartisan and many would say a nonpartisan issue. My question is, what do you think distinguishes Alzheimer's disease from all the other issues in Washington that allows members of Congress from both parties to come together and work in a positive, bipartisan manner?
Well, first of all, people can get along more than they think in Washington. Like, I think right now there's a perception we have all this partisanship because of the COVID bill, but we've already passed 4 COVID bills, so we can get along. I think Alzheimer's research is such an obviously good cause. I don't know anybody out there who doesn't know somebody, frequently loved ones, who have Alzheimer's, and I think that's why we've been able to get together on a lot of things. I hope we are able to get along, though, more on lighting a fire under these people a little bit more, because, like I said, I mean, this COVID kind of shined a light on these agencies, and I don't think they're necessarily doing the best job. So hopefully when we get not only bipartisan agreement that we have to fund more, but bipartisan agreement there has to be more of a sense of urgency out there. And maybe if drugs are still considered experimental, I think we're going to talk about one of those later, we can do a better job of pushing the medical establishment into allowing these drugs. I'm trying to think what it's called here. Starts with a B.
Anucanumab, I believe you're referring to.
Yeah. See if we can do a better job of at least getting that out there before we know 100% whether it's effective or not. I know we're having a problem getting some stuff out there on the COVID, and kind of my attitude is, what's the downside? But hopefully we get more bipartisan push there. And I do, on all these bills that I co-sponsor, they're all bipartisan bills, and I enjoy working with the Democrats on them as well.
Thank you. And I did see you on a coffee with the candidates, and you mentioned that just recently, a couple weeks ago, on TV in Milwaukee. So I appreciate your answer on the bipartisanship. So. For those of you who have joined us, please continue submitting your questions on Alzheimer's and dementia in the chat, and we'll get to those in just a couple of minutes. But I did want to follow up on Dana's question. One thing that I've always noted about Alzheimer's and dementia is that it impacts so many people. You've got issues related to healthcare, family caregivers, obviously, ensuring individuals with Alzheimer's are not exploited, and many, many other issues. And for many of us on this town hall, as the congressman just mentioned, it seems impossible to believe, but there are still people who have not been personally impacted by Alzheimer's or dementia. We had a state senator at a walk last year who mentioned that he had not personally been impacted until just recently. However, those people who are still significantly impacted by the costs associated with the disease. In 2020, Medicare and Medicaid will spend an estimated $206 billion caring for those with Alzheimer's and other dementias. It's estimated that $155 billion will be spent by the federal government alone under Medicare, which is 1 in every 5 Medicare dollars will be spent on someone with this disease. As you see here on the graph, it breaks down the total cost for caring for individuals with Alzheimer's in 2020. Medicare covers about 50%, but out of pocket still is $66 billion just for providing care for Alzheimer's and dementia. Those numbers are truly staggering, but by 2050, the combined Medicare and Medicaid spending on people with Alzheimer's will skyrocket to $777 billion, and that's in 2020 dollars, not adjusting for inflation. In 2050, just Medicare spending alone with Alzheimer's will total $584 billion, an increase of 278% from today's spending levels, and it will represent 1 in every $3 of total estimated Medicare spending. The graph here shows the trajectory of prevalence. That's the line graph on the top, going from 5.8 billion to 13.8 billion individuals. And the bar graph illustrates the estimated costs associated with Alzheimer's. And you can see 1.14 trillion in total costs, the 777 billion being the Medicare costs. Congressman, can you talk just a little bit about how the federal budget is ill-prepared for such a significant increase in just 30 years? And can you also talk about how support from Congress for increased investments in Alzheimer's research is so critically important to find a way to prevent, treat, or at least slow the progression of this disease?
Well, absolutely. We know outside of Alzheimer's research and costs connected to Alzheimer's, our federal budget is a mess in a variety of other ways. And you talk about Social Security, Medicare in general, obviously something has to be done. I know right now, and I disagree with Nancy Pelosi on this, they're also trying to get through some big tax cuts aimed at some of the wealthiest Americans. I don't like that. But I think when we show that graph that's out there, we can use it or hopefully leverage it for more Alzheimer's research, not only hopefully medications or that sort of thing to delay the onset, but education, helping people how to avoid Alzheimer's, both diet and perhaps mental exercise. I knew this meeting was coming up. I was kind of struck last week. I was meeting my mom, who's 89, and she's very conscious of the fact that not only should she do what she can to stay physically healthy, to make it to 99, which would be cool, but mentally healthy. And, she always makes sure she's using her brain for a variety of things. So I think we have to continue down kind of a two-way path. We've got to look for medications and that sort of thing that will both delay the onset of Alzheimer's, and we have to do a better job of educating people what they can do both diet-wise and kind of exercise the brain to make sure they don't get it. Because I think sometimes, I'm reading a book right now, it's called How to Stay Young While Growing Old or something. And one of the things it touches on is diet, primarily focused on diet. And they not only talk about the importance of physically staying alive, but being mentally sharp. So I think those are the two areas that we can focus on. And I think the graph that you're looking at should scare Congress to death and should make them realize that of all the areas that they can spend research dollars, Alzheimer's and related dementias is the place to go.
Thank you, Congressman. And we have seen a lot of information about lifestyle interventions and how that can help reduce your risk factors for developing Alzheimer's or dementia. So a lot of research going on in that field as well, looking at diet, making sure that you are cardiovascularly fit and being active and how those activities can help delay or at least reduce your risk factors for developing Alzheimer's or dementia. Congressman, our next question comes from Carol Wessels, and Carol is an Alzheimer's Association chapter board member, and she's the chair of the advocacy committee. And Carol asks that during the current COVID-19 pandemic, the most devastating impacts have been among older Wisconsinites, and particularly those living within our long-term care facilities. Measures were put in place limiting access to residents within these facilities, which were obviously critically important to prevent the spread of the virus in these long-term care facilities. However, these measures have taken a heavy toll on residents who've become victims of a double pandemic of social isolation. The Alzheimer's Association recently released a set of recommendations for long-term care facilities that request state and federal governments to require long-term care facilities to provide rapid on-site COVID tests before allowing a visitor to see a loved one. He believes that the only way to safely end social isolation is for residents in long-term care is to ensure that every long-term care community has access to these rapid point-of-care testing for all residents and staff, as well as visitors. Congressman, how has Congress and the federal government provided resources to ensure that these facilities remain safe for residents and staff? And I think that really that fourth COVID bill really hits on a number of things that that has been done recently.
Right. First of all, I agree. We have a major problem, and I think it varies from facility to facility, the degree to which you're able to meet with your loved ones. I think some have been more aggressive during the summer about letting people outside to meet with people, which is good, and others are not as aggressive. And I would, if we have anybody out there who has loved ones in these facilities, I'd familiarize yourself with those facilities that are more aggressive about letting people get outside with the loved ones, because I don't think every facility is doing the best they can there. Obviously, I'm more concerned than ever now that as we go into the winter months, you know, even these facilities, I don't know what they're going to do. Because, you know, you can take your parents out when it's 70 degrees outside, 80 degrees outside. It's not something you want to do when it's 5 degrees outside. I do think one solution is to have more of these quick turnaround 10-minute tests. We recently began in Oshkosh in our district having these tests available to the public, which is good for a wide variety of reasons. I hope that in any future bill, we put a lot more money into this. As I understand it, one of the reasons we don't have more of these 10-minute turnaround tests is the manufacturing ability was just not there. And as a result, they didn't have enough tests. I think given the trillions of dollars we've thrown at it, that's ridiculous. I mean, everybody should have access to these 10-minute tests. It's of particular importance in these care facilities because you do want to have people get in there. And one way you can get people in there is take the test. If you have one of these 4 or 5 day tests, and I've had both types. I've had 6 tests so far. 3 were the 10-minute jobbies and 3 were the wait 3 or 4 day jobbies. And it's sure better if you can get the results in 10 days. And they've been out there for a long time. I think I had one of those tests when I met with Vice President Pence like 3 months ago. And now we have them for the public in general in Oshkosh. But anything we can do to get more tests like that available so the average care worker can get them and so the average visitor can get them is a big step in the right direction. And it's frustrating that so far they've kind of been only available to people who really need them, including some caregivers. But that's certainly on the next COVID bill, something we've got to look at. And I don't understand, given that we put $3 trillion at this already, how we have not gotten factories up and running, producing, you know, tens of thousands, maybe hundreds of thousands of these every day. And you can think it's more than just your group that should be thinking about it. if you're required one of these tests, it kind of takes you out of commission for 4 days. So people are taking off of work all the time, not only in these extended care facilities, but everywhere else. I've had people in my office where we're doing the Zoom interview out of. They've been taking time off as they wait 4 or 5 days for a test, which frequently comes back negative. I agree with you. I'm glad you brought it up to me again. And I'll tell you something else, by the way, that bugs me, just to give you a peek under the hood at the way Congress operates. When this thing began, I would get on usually 2 interviews a month, maybe a Zoom, but more likely just a telephone conference call as to what was going on here. I don't think I've had one of those in a month. So we've gone from a place where Congress is being updated twice a week with somebody connected with the COVID to maybe once a month. I think that's completely irresponsible. I don't know whether to blame congressional leadership for that, whether to blame the Trump administration on that, but we are not getting, as congressmen, the access to the important people dealing with this crisis like we were before. And this is the type of thing we could bring up to them, but these people aren't hiding. When you call them, it's very hard to get a hold of them. But that's just something that I don't think makes the papers. But for whatever reason, our contact with all of these CDC, NIH, the disaster folks, all these things is slowing to a trickle when it should be going the other way. We should be getting more access to these folks. So, but go ahead, on to the next question.
I really appreciate your answer on that. It's something that our association has been pushing very hard is getting loved ones in to be able to see their families in these facilities. And the way that we believe that you do that safely is through a rapid test. And when we see things being prioritized, and I'm a Badger season ticket holder, I love the Badgers, but watching the Badger football program being prioritized for rapid tests over loved ones being able to see someone in a facility is truly heartbreaking.
Absolutely. And like I said, it's getting so cold, you're not going to be able to visit your loved ones outside like you were before. But at least I found sometimes a dramatic variance from facility to facility. And I think some of these facilities could have been pushed a little bit more. We may yet get a few good days out there. They could be pushed a little bit more to allow you to meet with people outside.
Thank you. And thank you to everyone. I've seen a bunch of questions coming through the chat. If you've not already done so, please continue to submit your questions about how Congress is addressing Alzheimer's disease for Congressman Grothman in the chat function down below. I'm going to turn it over. Robin and I are going to co-host now. Robin, can you share our first question from the chat with the Congressman?
Yes, Congressman. This question comes from Therese Capizzi. The FDA is currently reviewing studies from Biogen regarding the most promising recent Alzheimer's drug, aducanumab. Is there a role for Congress to leverage what we've learned from the Trump administration's COVID warp speed vaccine and Right to Try Act to help accelerate therapeutics for Alzheimer's disease?
Absolutely. First of all, you can see how quickly, I always thought Alzheimer's should be a #1 crisis, emergency. Let's go as quickly as we can. We found out during the COVID that you can always go faster. And secondly, there's a drug I'm working on the COVID, so I'm fighting this thing a little bit separately, called fenofibrate, in which there are preliminary studies that show that drug, and I think there are preliminary studies showing Biogen, can be successful. But they want more studies, and let's wait, and maybe in 6 months we can use it. Well, what's the downside, right? And frequently these drugs, particularly if they aren't showing any negative side effects, let's get them out there. And if 3 months from now they weren't particularly successful, or we find other drugs, fine. 3-6 months from now, then we can pull them off the market or use something else. But this idea, when you have drugs that there's no downside on, and there's a given degree of evidence that they're successful, and I understand with Biogen, the studies are a little bit mixed, some very good, some kind of neutral. but that's no reason why people shouldn't get access to it. And I think maybe we can use I'm popping the screen here. Maybe we can use the fact that I think the medical research establishment is not as aggressive as they should be on some of these COVID drugs, and the fact that in some they are becoming more aggressive, to say if we can use these things for COVID, why can't we adopt the same protocol for Alzheimer's? And if drugs look like they're going to work, let's use them. Right?
And
What's the downside? I mean, why are we waiting another 6 months? I think on Biogen, they're waiting until March to horse around and let's do some more research and blah blah blah. Well, there's some people who need it now, and as far as I know, there's no downside to trying it.
And your answer is truly consistent with what our association's testimony was before that review panel last week. Hoping to move forward, it is the most exciting development that has occurred in Alzheimer's in literally years. So your answer is consistent with where we are as an association. So thank you for your answer and your support. Robin, do we have another question that was submitted?
We do. The next question comes from Jennifer Fisher. Congressman, earlier this week, the Senate Appropriations Committee included a $354 million increase for Alzheimer's and dementia research funding at the National Institutes of Health in their proposed 2021 fiscal year budget. Unfortunately, the House did not include the same increase in their bill. We saw the same thing occur in fiscal year 2020. So can you provide us with some information about what is next in the appropriations process, and also the likelihood that the increase in research funding is included in the final bill that will be sent to the president for his signature?
I'll certainly weigh in. Normally these bills, like I said, even though your funding is supposed to begin on October 1st, they don't pass them. I'm not the one who decides when they go to the floor. That's why I'm referring to M. I guess I'm one of them. They don't pass them until they're voted on, frequently the week before Christmas. And who knows, maybe they'll try to wait until we get a different president the last week in January, which would be unfortunate. I think it means that the people who put together that appropriation bill in the House, which is right now primarily, I'm a minority, I know these people, they apparently didn't consider it as high as priority as the people in the Senate. And I think if you go through the different diseases out there, I think one can easily find, without targeting somebody, other areas which I don't think should be quite as high priority, who are maybe getting more money. So the money should certainly be available there. I will look more carefully at both the proposals and see what I can do to weigh in with the House negotiators. The way the budget works is a budget committee sets a top line number, and then the question is, where are you going to prioritize? And apparently the House negotiators didn't prioritize Alzheimer's research like the Senate. So I will certainly weigh in though and point out that the House bill should look more like the Senate bill. And there are other diseases, you can gossip later what they are, that I think are getting more than enough, are getting enough money that we could focus on Alzheimer's more. And for all the reasons we've talked about over the last half hour, Alzheimer's and memory problems should be the number one priority.
I appreciate that answer. And I just want to drop in that it was through the support of Senator Roy Blunt and Senator Patty Murray, Senator Blunt, a Republican from Missouri, Patty Murray, a Democrat from Washington, that the increase was included in the Senate version of the appropriations process. So we're very excited and hopeful that through the full appropriations process, that the full $354 million increase in Alzheimer's disease research funding will be included in the bill that ultimately goes to the president for his signature. Our next question comes from Elaine's iPhone. Elaine would like to know if you could tell us what the government is doing to help provide individuals and their families with Alzheimer's who have early onset. And she says that her husband was diagnosed at age 53. I believe she's referencing the inclusion of the provisions of the Younger Onset Alzheimer's Disease Act in the reauthorization of the Older Americans Act, Congressman.
Right, and as was mentioned, that is something that we were able to pass within the last year. I should know exactly the day it was effective, but if it's not passing through your area, it should be something that's implemented very soon, and I think it will provide the same benefits whether you're over 60 or under 60, and if the local providers are not aware of it or it's not being administered in your area yet, it should be happening soon.
No, you're absolutely correct. The provisions were to provide individuals who are under 60 the same supports and services that individuals over 60 are eligible for under the Older Americans Act.
Yeah, and I'm under the impression that should be up and running right now. You can tell me. I mean, obviously, when we pass a bill, sometimes it doesn't become effective till a month or 3 months down the road or something. But I think that should be effective by now. Am I right in that?
I believe it is. We can check and get that answer for our participants. Robin, do you have another question from the chat?
Yes, I do. The next one comes from Randy. He has experienced too many issues with private care and rehab facilities, and he needs to look to get more support for families who choose to provide their own care. Can the feds help promote this at state and local level? That is, he could use money more efficiently through private care, where an individual will more quickly get to looking to Medicaid.
I think that's true. And I think private care and family weighing in sometimes is even superior, frequently superior. And the more we do to adjust the law, the benefits are available for that, the better off we are. By the way, Patrick, are you on the line? Okay, I have, is he on the line? Oh, but why don't you tell him to unmute himself? I have a staffer who handles Alzheimer's issues for me, and I want to ask him whether he wants to jump in on some of this stuff, but I'm not sure he's on mute. We're going to unmute him now. Okay.
If he's on, is he on the phone, or is he on as part of the guests?
We don't know.
Okay.
Okay. But no, I think outside traditional facility is always beneficial if possible.
If Patrick has joined on the video, I can unmute him. Just have him send me a chat message, and we can have him join the conversation. We always appreciate extra special guests. Our next question comes from someone named Randy, and it is also about quick tests for visitation. And he says he's not found a facility that will even consider them. If you get tested outside and have a positive antibody test, they won't consider. I think that I get the gist of his question. This has been a real issue for individuals who have loved ones who have Alzheimer's or dementia, and the utilization of technology to have a Zoom meeting or a Zoom visit or a QuickTime call or a FaceTime call, it doesn't work for individuals who especially have advanced or progressed Alzheimer's. And there are concerns that we are just not doing enough, and we are watching people literally deteriorate before our eyes because of Alzheimer's, because of social isolation, and multiplying that by Alzheimer's. I had an advocate who she laughed and said, "I'm going to show my age," but she equated it to the difference between records. A 78 and a 54. I probably have messed those up, but literally it is sped up because of social isolation, the deterioration due to Alzheimer's. So if you would like to just talk about that a little bit.
No question, across the board. If you know somebody in one of these facilities, I mean, their life revolves around their family. And if you don't get that mental stimulation from your family, your mental decline is going to accelerate. I was glad that we had the Surgeon General in this district last week in Oshkosh. And in Oshkosh, we now do have, and as I understand it for university, it's the first of its kind in the country. We can just show up at the UW campus and get these quick tests. But it would be nice if we got to the point where they were available at least one day a week at every care facility so that people could check in and they don't have it. And I think the more of these they produce, the cheaper they should be. It's still not that cheap, but right now we have it in Oshkosh. I'll be disappointed in 5 or 6 months if we don't have 6 or 7 somewhere in this district. And I think if you can show that you're testing negative within the last 24 hours, I think these facilities may be a lot quicker to allow you to get in. But I agree with you entirely. And I think across the board, the same thing is true of hospitals. I think sometimes the health professionals don't appreciate the psychological side of a disease. And everybody feels better if they know people are around who they love, who care about them. And if you just have kind of an overcautiousness the other way, people are going to decline mentally. And we all know people who are stuck in a facility and they haven't seen people for months. And you're right. The way to deal with that is to get these rapid tests out there where you can allow more interaction with relatives. And quite frankly, not only in the care facilities, but in hospitals as well. You have the same problem, right? You get people in there, it's a traumatic time of their life. They're very sick. And all of a sudden you can't see your loved ones. So, by the way, I'll give you an anecdote on the hospitals too that I thought was illuminating. I talked to a nurse and she attributed after this COVID, they had an increase of people falling down in the hospitals. And she attributed it to the fact that they weren't allowing visitors. You feel better with visitors, and a lot of time visitors are there. They help people walk up and down the halls for rehab. They help people get to the bathroom. So this nurse felt there was a real problem, a downside that her hospital was not taking into account when they were more aggressive in not letting people in the hospital. And certainly if you had rapid testing there as well as these long-term care facilities, you would be able to allow more people in. And like I said, you can tell I will push it. I think given the amount of money they've been throwing around, we've already spent $3 trillion. I think when you talk about a bill right now, I think when they negotiate next week, I think the Democrats will be at about $2 trillion and the Republicans will be about $500 billion. But when you're talking about dollar amounts of that type, I think there should be more tests available. And I would think over time that as you produce more tests, the cost of a test should drop too. But at least we've been told that part of the problem is so far, they just aren't producing the tests rapidly enough.
I see that Pat has joined us. Pat, did you have anything you'd like to add?
Yeah, I just wanted to kind of piggyback off of Congressman Grothman on the rapid test issue. Just a couple days ago, Congressman Grothman, along with 19 other members of Congress, I think our friend Representative Tiffany was on the letter as well, but we sent one to HHS requesting that, all this, the pot of money that these assisted living communities are able to take advantage of is the Provider Relief Fund, which was included in the CARES Act, the large coronavirus relief package that we passed. We sent a letter to them requesting that when we re-up this, likely in December, hopefully, we want to make sure that a specific portion of that is allocated for long-term care facilities because, like Congressman Grothman has been saying, we do believe that rapid tests are the biggest contributing factor to making sure that, people can see their loved ones and do so in a safe manner. So they can use those funds from the Provider Relief Fund to help procure those tests. So that's going to be something that we're looking forward to in December when this bill hopefully passes.
I appreciate that extra information. I'm sure a lot of our attendees do as well. I have a question about what pressure can be brought to bear on facilities to accept proof of negative test results to permit visitors. And I just want to CMS, I'll sort of start this off, and Pat or Congressman, if you want to tag in. This is something that we've been working on, and it really is a state-by-state issue. So it's not really a congressional one, particularly for assisted living facilities. It's not a congressional thing. The federal government does have some oversight, particularly on nursing homes, but this is something that we've been working on at the state level to try and work with our current gubernatorial administration of Governor Evers to get rapid testing to allow people in safely. Pat or Congressman, anything you'd like to add to that? Visitation is obviously a huge issue in light of the weather turning and making sure that social isolation doesn't have a significant detrimental impact to those residents of facilities.
I agree. I think we want to go ahead, Patrick. I'm sorry.
Well, I think I was just going to say, we've had, conversations with a lot of people who, help run these assisted living facilities. And obviously, their policies vary between, facility to facility across the district. And I think Glenn's been able to get a good sense of that because, he does visit these places. And I think, we have to have better guidance on a, statewide level for these facilities and hopefully enact, more uniform policies when we do have those funds flow in so that they can have more rapid tests because we found that, there isn't really a uniform policy and depending on where your loved one is located in one of these facilities, their specific policies vary from facility to facility. So, we need to be connected with the governor's office and kind of have a uniform approach to them. So, people are able to see their loved ones in these facilities. But it's been a struggle.
I think as you weigh in, it's good because I think any business, in today's legal environment, they're always afraid. We had tried to get something in one of these bills providing a little bit of immunity, but legal immunity. But if there's no legal immunity, people are, a given number of businesses are always going to be super cautious. And they're worried that somebody's going to get the disease, but they don't look at the huge problem of all the people who are really declining as they have no visitors. So I think the degree to which the federal government can weigh in, or even more the state government, because I kind of like local control, really regulating these facilities better, insofar as they can set up a safe harbor for these places, it would be all the better. And like I said, it varies from facility to facility, which tells you that there's some people who feel that more visitation is capable.
Yeah, thank you both for your insight on that. Robin, I think we have time for one more question before we wrap up and do a couple of last minute things.
All right. I'm not so sure that this is a question as much as it is a statement. This is from Randy, who cares for his mother who is 90 and has Alzheimer's. The other aspect of this limited visitation puts stress on the family to continue care beyond when they should. So there is a point specifically with respect to hygiene that it may not be in the best interest to continue home care, and limited visitation hopefully will not make that decision more difficult given that reality. So I think what Randy is referring to is that we at the Alzheimer's Association do hear from a lot of families who feel they should, whose loved ones are at a point in time where they really should be transitioning to a facility, but given the circumstance, they are very hesitant to do so.
That's a good point. It's something we can use when we talk to the state or when we talk to the national, because you're absolutely right. And I can see how that would happen. You feel you shouldn't be taking care of mom anymore. On the other hand, if you know transferring her to a facility means you may never see her again, it makes that transfer very difficult.
Yeah, definitely. Very good point. So with that, I want to thank Congressman Grothman for joining us for today's Alzheimer's Association Town Hall. We're very grateful for your participation and your generosity of your time and your staff's time this morning. Congressman, before we let you go, do you have any closing remarks? Anything you'd like to say?
No, it's just a priority. Like I always say, in Washington, it comes down to who works the hardest. You always have a good organization. You know, I hope you have such a big team listening in for all the other congressmen around the country. I think you're doing a uniquely good job. But if we got, and I don't know how many congressmen are willing to sit in on a Zoom call like this, but I see right now we're at 57 participants. And I think for any congressman, if you're on a Zoom call with 57 participants, in addition to the public policy reasons why we want to work for your agenda, there's political reasons as well. So I thank you for doing a good job of getting so many people here. Like I said, you can prod other people around the country to make sure they do such a good job. Hopefully, we're going to get the amount of research dollars that we want in the compromise appropriations bill that presumably I'll be voting on sometime in the next 2 months. And I'm glad to see you all. I guess one benefit of these Zoom calls is I get to see more people. I guess usually this time of year, we maybe see 8 or 9 people live and in person, although we still hope next year we're able to do this live and in person. But thank you much. Mike and I have been working together, like you said, for I'm sure over 20 years now. So good to see you. And hopefully we'll begin to make some more progress on 2 things. Emphasize medical treatments that'll delay the onset or lessen the onset of Alzheimer's. And I think we got to do a better job, and I'm kind of getting this from my 89-year-old mom, educating people on the lifestyle you should be living, both diet and using your mind, because I know she's very conscious of the fact that she's 89 and wants to make it to 99, but she wants to make it 99 and not have dementia-related diseases. So I've got something else that didn't occur to me till dealing with her now, that I know she does a lot to make sure that her mind is sharp, and we can educate other people on that as well. Particularly because people like my mom, if you're all alone in your house, it's easy to not get that mental stimulation.
Thank you for that, and thank you for the kind words. I think you've aged much more gracefully than I have over the 2 decades. I also want to thank everyone who participated in today's virtual town hall with Congressman Glenn Grothman. It's through the work of our volunteer advocates like all of you here today that the Alzheimer's Association is successful in Washington, D.C., and obviously Madison as well. Because of our volunteer advocates, Congress has increased Alzheimer's disease research funding from $448 million per year in 2011 to over $2.8 billion per year in 2020. And as you heard, we're not done yet. We're trying to get over $3 billion this year. In just the past 2 years, we've passed the Younger Onset Alzheimer's Disease Act that the Congressman was a early supporter of, and the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act. We truly appreciate you all being a part of this town hall and helping us achieve our vision of a world without Alzheimer's and all other dementia. If you're interested in becoming a volunteer advocate or would like more information about our volunteer advocacy efforts, please text ALZVOL, that's ALZVOL, to 52886, or visit allsimpact.org/volunteer. Or heck, you can even email me at mlbruin@alz.org. Finally, our 2021 Alzheimer's Advocacy Day in Madison, it's going to look a little bit different this year. We're still putting the finishing touches on what we expect to be a very exciting virtual program. So please keep your eyes open for invitations coming in the very, very near future. And with that, again, a very heartfelt thank you for Congressman Grothman and Pat, his staff, for their generosity with their time today and sharing a little bit of expertise and quite honestly, a window into Congress that I don't think everyone always gets on a daily basis. So with that, thank you, and we will see you next time.
Can you guys still hear me?
Absolutely.
One other thing that you guys can push for a little bit. I'm on a committee called Government Oversight, which isn't normally your big committee dealing with research. It's not as important as appropriations say. But a few years ago, we had a committee hearing on cancer research. And I thought it was illuminating the degree to which different research facilities were working with each other or not working with each other. And just throwing money at a problem, and we want to spend more money here, but just throwing money at a problem doesn't necessarily help. I think maybe something that nationally you could advocate for is have a hearing on Alzheimer's research, bring in people from different institutions that are doing the research so we can make sure that they're coordinating with each other and find out what's going on. So there's a suggestion for something. We got Patrick on the other line here. We can try to put together a letter from people on the committee. The guy who's the chair of the committee is a guy by the name of, it's Carol Maloney from New York City. And we can ask Carol to hold a hearing, if not a full hearing, at least a subcommittee hearing on this topic, which I think will kind of be good, because when we did the cancer hearing, I was surprised the degree to which the different facilities, I don't think we're coordinating with each other the degree to which they should. So there's another suggestion of something we can do.
Very much appreciate that. And that's something that we've looked at, particularly coordination through the BOLD Act, which is addressing Alzheimer's disease in just a little bit of a different way through the public health sphere instead of just through departments on aging and departments on health. So looking at how we can create different programs that can be replicated across all 50 states to help in the public health sphere. So looking at early detection and diagnosis, as well as lifestyle interventions, those types of things. So really appreciate that suggestion.
Okay, thanks. Sorry to butt in there, but.
No, absolutely. Anytime, Congressman. With that, again, thank you so much for your generosity of your time, and Pat, you as well. And thank you all for joining us today. Really appreciate you taking a little bit of time on a Friday morning to spend it with us. See you next time.
Absolutely. Thank you very much.